Being a doctor could be rewarding, but this profession comes with cons of its own. First, the long time frame. The path to becoming a doctor is demanding. It asks for not just complete dedication and commitment, but also resilience for a long time. It takes an average of 15 years of learning to finally start giving back to the community and also to self-sustain oneself and the family. Most of the youth goes away buried in books and the next half for ensuring societal existence on a whole. Becoming a doctor has multiple steps and every step is difficult. Whether it's fighting for the undergrad seat or the internal exams, the yearly professional exams or the post-graduation entrance exam, you have to face challenges all throughout. The whole process requires immense intelligence, hard work, and a sheer willingness to sacrifice everything that stops you from achieving the heights of medical excellence. The journey begins with the preparation for the undergraduation course, which includes a thorough knowledge of biology, physics, and chemistry. Aspiring doctors must maintain high academic standards and be mentally prepared for the gruesome competition to enter a medical school. Upon admission to medical school, the educational demands intensify exponentially. Medical students have to tackle an extensive curriculum covering around 20 subjects in just 4 years. The sheer volume of information and the pace of learning can be overwhelming, and it never gets easy with time. Rather, with every passing day, the world's expectations keep increasing, and so does the points to remember. In addition to classroom learning, medical students engage in clinical rotations where they work directly with patients. The most of the times they are supervised, but that doesn't decrease the responsibility quotient on the intern. A patient's well-being always depends on the teamwork, and the team includes the intern, for whom, however, this is the best learning phase. After the undergraduation course comes the most crucial phase in a doctor's life. Almost all countries with a medical curriculum have a qualifying exam, the scores of which decides where the doctor will receive the specialist training. The qualifying exam is ruthless and the preparation for the same is crucifying in few countries. But if a doctor has to achieve their dream, they must and have to go through this phase with deep breaths and a meditated mind. Residency, either in medicine or in surgery, lasts from 3 to 7 years, depending on the specialty and each country's medical council. This is the most unjustified phase of a doctor's life. Long duty hours, sleepless nights, tough patients, and responsibilities beyond the age permits, along with managerial duties from time to time. Even with much talk about mental health and a relaxing working environment, the strain and stress of a postgraduate life remains unadulterated. Few doctors also offer further specialization, and this can be done in different ways in different countries, taking up to an additional of 3 to 6 years. The doctor then can be called as a cardiologist or a neurologist or an endocrinologist or an oncosurgeon. Most doctors start their careers as practitioners after this. However, the learning could still continue with different fellowships and certification programs available. It's true that doctors have to keep studying. In many countries, doctors must obtain a medical license to practice independently. Board certification exams are tedious and require clinical, teaching as well as research expertise and need to be taken at regular intervals. The long hours. The demanding nature of a doctor's work extends beyond the rigorous educational and training requirements. Doctors often find themselves navigating through long and irregular working hours, which can be physically and mentally taxing. This aspect of the medical profession underscores the dedication and commitment required to provide essential healthcare services. Doctors frequently work extended shifts that can span well beyond the typical 8-hour workday. In hospitals and emergency departments, it is not uncommon for a doctor to be found to be working for 12 to 36 hours at a stretch. These prolonged shifts demand a high level of concentration and stamina. The healthcare field operates around the clock, and the doctors may need to adapt to regular schedules. This includes working on weekends, holidays, overnight shifts. The unpredictability of patient care often requires doctors to be available at all odd hours. Many doctors stay on call, meaning that they must be ready to respond to emergencies or patient inquiries even when they are not physically at the hospital. On-call duties can disrupt personal time, sleep patterns, and the shift changes in healthcare settings can be frequent, requiring doctors to transit between day, evening, and night shifts. These frequent changes can disrupt the circadian rhythms and contribute to fatigue. The immense responsibility that comes with being a doctor is the central aspect of the profession, and it entails managing the health and well-being of patients, often in critical and life-altering situations. This responsibility can be both emotionally and a stressful, taxing period. Doctors are entrusted with the lives of their patients. The decisions they make, from diagnosis to treatment, can have profound and sometimes irreversible consequences. This constant awareness of the weight of their decisions can be emotionally burdensome. Doctors frequently encounter patients and families in moments of crisis and vulnerability. Witnessing suffering, delivering difficult diagnosis, or coping with a patient loss can be emotionally draining. Empathy and compassion are thus integral, but can also take an emotional toll. The high level of stress. The stresses that doctors face in their profession are multifaceted and can emanate from various aspects of their roles, both clinical and administrative. These stresses are part and parcel of the medical profession and require doctors to develop coping mechanisms and resilience. Working in high pressure settings like an emergency room or the intensive care units or the surgical theatres require doctors to remain focused and composed even in the face of life-threatening situations. The urgency of these environments can be extremely stressful. Beyond patient care, doctors are often burdened with administrative tasks such as paperwork, electronic health records, insurance billing, and compliance with regulations. The time spent on administrative duties can detract them from direct patient care and contribute to stress. Doctors frequently wear multiple hats, including a clinician, educator, researcher, and an administrator. Balancing these roles and managing competing demands can be overwhelming. Meeting patient expectations, particularly in an era of readily accessible medical information, can be challenging. Patients may have high expectations for quick diagnosis and treatments, which may not always align with the clinical realities. The demanding work schedules that doctors often contend with, including long and irregular hours, can indeed pose significant challenges when it comes to achieving a satisfactory work-life balance. These demands, which may require doctors to work on weekends, holidays, overnight shifts, can profoundly impact their personal lives and relationships. Doctors may have limited personal time due to their professional commitments. This can hinder their ability to engage in hobbies, exercise, pursue personal interest, or simply relax and change. High levels of competition. The field of medicine is known for its high level of competition. Not just the admission to medical school and subsequently securing a residency position, but also the post-education practicing is challenging and competitive. And the fact that every day the competition is increasing becomes daunting and creates an unhealthy environment.